Nails are keratinized, semi-transparent epidermal formations lining the dorsal surface of the distal phalanges of fingers and toes. Nails not only have an aesthetic function, but also a protective one, as they protect the fingertips and surrounding soft tissue from trauma and injury. They are also a kind of precision tool, as they help the hands to take very small objects and perform some delicate actions, such as remove a thorn with tweezers, using the needle to sew, or to untie a knot in the shoelaces. Anatomy of nails. The part that we all call the nail is technically called the nail plate, and is made up of layers of keratin, a stable and resistant filamentous protein rich in sulphur, which we also find in the epithelial cells of the epidermis and in the hair. Under the nail plate we find the nail bed, the living part of the nail. It is full of blood vessels and nerve endings, which give it the classic rosy color. The deepest part of the nail bed is attached to the distal phalanx bone of each finger. Finally, we find the nail matrix, the germinative part of the nail that deals with the production of the nail plate and therefore with the continuous growth of the nail, on average between 0.1 and 1 millimeters per day. At the base of the nail we find the lunula, a small whitish area which takes its name from its typical crescent shape and is that part of the matrix visible from the nail plate. The appearance of our nails can reveal valuable information about our state of health. A healthy nail has a smooth surface, a pink color, and good resistance. Yellow nails. Yellow nails, whose medical term is Xanthonychia, indicates a yellowish color of the nail plate. Among the main causes we find cigarette smoke, in particular nicotine and tar, which stain the nails of the smoker while holding the cigarette. Not only that, smoking hinders blood circulation, significantly reducing the oxygen supply to tissues, including nails, altering their color and structure. Another cause of the yellowish discoloration of the nails is when a particularly dark nail polish is applied without having applied a protective base. This is a fundamental step, which not only makes the nail polish last longer, but prevents the nail plate from being in direct contact with the colored nail polish, thus preventing the nail from turning yellow. Also beware of aggressive or poor quality solvents that are used to remove nail polish. They can damage the nail plate, which thins out and flakes off, forming yellow spots on the nail surface. A yellowish discoloration of the nails can also be a symptom of liver disease, gallbladder disease, or a fungal nail infection. There is also yellow nail syndrome, a rare disease that presents a typical triad of symptoms. Pleural effusion, accumulation of fluid inside the pleural cavity. Lymphedema, that is a stagnation of lymphatic fluid in some districts of the body, and dystrophic nails of yellow color. Brittle nails. The degradation of the keratin filaments of the nail plate makes the nails brittle and therefore tend to break more easily. Among the most common causes we find incorrect habits, such as the use of poor quality nail polishes and solvents, aggressive manicures or done by inexperienced and qualified personnel, or the inevitable aging. Also beware of continuous exposure to chemicals, such as soaps, detergents, and disinfectants, or prolonged contact with water, such as washing dishes, as they promote dehydration of the nails and therefore greater fragility. Nail fragility can also be due to a bad diet or a lack of vitamins, especially vitamins A, E, C, and B6, and some minerals, such as calcium, phosphorus, zinc, iron, and copper. In other cases, however, having brittle nails is a symptom of a disease, such as anemia, or a thyroid disorder, such as hypothyroidism. Dark nails. The term Melanonychia indicates a brown, grayish, or black discoloration of the nail, following the discoloration of the nail bed, which is caused by an accumulation of melanin in the nail plate. It can affect the entire surface of the nail or manifest itself with horizontal bands. Generally, the cause is of traumatic origin, which can be accidental or from sports. Closing your finger inside a door or dropping a heavy object on it causes the rupture of small blood vessels in the nail bed, and therefore the formation of a subungual hematoma. The nail will take on a blackish color due to the accumulation of blood under the nail, which changes color once coagulated. As far as sports injuries are concerned, melanonychia is very common in runners, especially if you use shoes that are too tight or big. This is because the small blood vessels located in the nail bed undergo continuous microtraumas at every step due to the friction of the foot against the tip of the shoe. Other causes of black nails are the intake of certain drugs, infections, or as a consequence of pregnancy or Addison's disease, a rare chronic pathology that affects the adrenal glands, decreasing their functionality and the ability to produce some hormones, such as cortisol and the aldosterone. In some cases, the presence of a dark streak under the nail may indicate the presence of a nail nevus or be the initial sign of a subungual melanoma, malignant tumor that arises as a result of abnormal activation of melanocytes of the nail matrix, which until then were inactive. Wavy nails. We talk about wavy nails when irregular streaks form on their surface. They are called Beau's lines, whose name dates back to the French doctor who described them for the first time, and indicate furrows of different depths that run horizontally along the nail plate. They are usually caused by trauma to the nail matrix, causing a temporary interruption in laminate production, or by bacterial or fungal infections. Among the main culprits we find an aggressive manicure or onychotillomania, a compulsive behavior in which the subject continually torments his nails, causing irreversible damage. However, if Beau's lines are visible on almost all nails, it could be an alarm bell for some skin diseases, such as psoriasis, uncontrolled diabetes, or hypocalcemia. That is when blood calcium values are reduced. Green nails. The term Chloronychia indicates a greenish discoloration of the nails. Typically, the cause is an infection caused by Pseudomonas aeruginosa, a bacterium present in soil, water, and most man-made environments around the world, especially wet ones. In general, it mainly affects people with low immune defenses or who have damaged tissues such as skin and mucous membranes, and in most cases it is contracted in a hospital setting. When Pseudomonas aeruginosa affects the nail plate, we speak of green nail syndrome, and the color is due to the production of some pigments produced by the bacterium, pyocyanin, blue in color, and fluorescein, yellow in color. Blue/purple nails. When your nails turn blue-purple, it means they aren't getting adequate oxygen. We talk about cyanosis, a medical term that indicates a condition in which the skin and mucous membranes take on a bluish color. It could simply be due to the cold, which causes vasoconstriction of the blood vessels of the hands and feet, but also to the presence of cardiovascular problems or lung diseases that require medical attention. White spots on the nails. Partial or total discoloration of the nail plate is called leukonychia and is characterized by the appearance of irregular white spots or streaks on the nails. Leukonychia can be due to repeated local microtraumas, such as a poorly performed or aggressive manicure, a lack of calcium, zinc, and vitamin B6, but also to onychomycosis. It is a fungal infection of the nails, both hands and feet, caused by pathogenic fungi, which settle in the space between the nail plate and the nail bed. In other cases, the appearance of white spots on the nails is a symptom of certain diseases, such as anemia, and liver disease, such as cirrhosis. Red spots on the nails. The appearance of red spots on the nails can be a symptom of psoriasis, a chronic inflammatory skin disease due to alterations in the maturation cycle of epidermal cells. Thus, dry and red plaques are formed, covered with silvery white scales, often located on the knees, elbows, and scalp. In other cases, the red spots on the nails form as a result of what is called splinter hemorrhage. The most common cause is when following a nail trauma, the small capillaries that flow in the nail bed break, with the consequent accumulation of blood that resembles the shape of a splinter. Other causes include inflammation of the blood vessel walls, such as vasculitis, systemic diseases, and endocarditis, and inflammation of the inner lining of the heart and heart valves. Nails are therefore a mirror of our health. Any change in the appearance or structure of the nails must never be underestimated because it can be the indicator of a more or less serious pathology or of harmful habits that are damaging them. In case you notice a chromatic alteration of the nail plate, always contact your doctor or a dermatologist in order to exclude any diseases.